Am I muted now?
Like this.
Okay, let's real quick. I'll just step on it. Go ahead and pause it.
It's on pause.
Let me start the meeting on this other end. Okay, you're on.
Well, I welcome the general public and all the commissioners to the July 13th, 2020 Los Angeles City Health Commission meeting, where we'll have some excellent presentations today. I want to thank everybody for putting up with the Zoom/Google meeting as opposed to being in City Hall as we usually are. Given these times, I appreciate people's patience with some of the logistical issues. I thank the city staff, especially Rita, for doing yeoman's work to get this up and operational, as well as all the technical support from the city. So publicly, thank you. Can we have a roll call, please?
Yes. Commissioner Mandel.
Present.
Commissioner Grimmick.
Present.
Commissioner Osi.
Present.
Commissioner Avila.
Present.
Commissioner Estrada. Commissioner Estradas.
It says she's here.
Okay, you need to unmute yourself, Commissioner Estradas. I see you on. Commissioner Hisarick.
Here.
Commissioner Cato.
Here.
Commissioner Kalfani.
Present.
Commissioner Lemos is not able to join us. Commissioner Shannon. Commissioner Shannon.
Her volume.
I know she's here. Commissioner Sirota.
Present.
And we have a quorum.
Commissioner Shannon is here. Sorry, I didn't know how to unmute.
All right.
Thank you, Ms. Moreno. Seeing that we have a quorum, let's go to first aspect is approval of the minutes of March of 2020. I'll ask for approval from one of the commissioners, please.
So moved.
Motion to approve.
And get it unmuted.
Can I have
Or second, whichever.
Can I have a second, please?
Avila, a second.
Thank you.
I'm sorry, who moved the minutes?
I think Commissioner Shannon approved the minutes. Commissioner Avila seconded it. So Commissioner Hisarick and Commissioner Grimmick also were close seconds.
We're late to the switch there.
Okay, then
it's kind of like Jeopardy. They didn't hit the button fast enough.
Yeah.
So are there any questions or discussion about the minutes? Seeing none, I'll ask for a vote. All in favor, say aye, please.
we'll need to do a roll call.
No, I don't think necessary. I'll ask for all approval, say aye.
Aye. Aye.
Anybody opposed? Any abstentions?
One question.
Yes.
If I was absent, I would have to abstain, correct?
I believe that's correct, Commissioner Cotto.
Okay, so I wasn't there, so I will abstain.
Thank you. So one abstention, Commissioner Cotto, all the rest in favor.
Was everybody there?
Yeah, there's a list of the people on the meeting.
Yes, but there's only 6 people present in the agenda at the last meeting.
If you were not present at the last meeting, then you would want to abstain?
I'd like to abstain. Sirota.
Calfani abstains.
Sirota abstains.
I'm sorry, I have Sirota, Kato, and Kalfani abstaining.
Correct. The minutes are approved. Thank you, Ms. Moreno. Moving on the agenda, I'd like to introduce virtually, though we might not be able to see them. We have had 3 superb and stellar interns. The commissioners all have met previously. Lauren Yen, who has come to our meetings for a significant period of time. Sarah Kashniati joined us about 6 months ago, 5 months ago, and she's been working very hard behind the scenes. And Marvin Chaudhuri has also joined us recently and has helped us put things together for this meeting and will be assisting. So hopefully you can meet them in person. I can tell you that they're hardworking, dedicated, extremely intelligent individuals with a passion for both the city of Los Angeles and for the public well-being and health. They will look forward to working with each of you individually. Moving on to the next agenda item would be neighborhood council. I think, Lauren, with the Zoom aspect of this meeting, is there anybody who is from the neighborhood council present? Seeing none, we'll move on to public comment. Is there any members of the public who have signed up for public comment or for questions?
Thank you, Dr. Manzo. We have a couple speakers who are going to be speaking tonight, and I can now welcome them into the room. You're on the line with the Los Angeles City Health Commission. Please state your name and the agenda item you're speaking on. We are unable to hear you. Could you please state your name and agenda item that you want to speak on?
Oh, hi. I'm Lauren Natoli from the AIDS Healthcare Foundation.
Welcome to the commission meeting. Which public comment or agenda item would you like to speak on?
No, just as a member of the general public, please.
Thank you for speaking with the commission today. You have 2 minutes to speak, and you may now proceed.
Thank you.
Tech support and Lauren, we're not hearing them.
Oh, okay. Hi, my name is Lauren Natoli from AIDS Healthcare Foundation. Thank you for resuming this meeting. I know it's a small meeting, but the state of the health in LA City cannot be minimized. So, as you know, last Tuesday, the LA County Board of Supervisors voted to start to plan the shutdown of Men's Central Jail in the course of over 1 year. And I'm in support of the deinstitutionalization of drug addiction and mental illness, and I think this is wonderful. But I hope that the city is prepared with the proper safety nets in place to make sure that those who are released are in regular health care and other needed services. I ask that you start thinking now about how you will advocate for the health and safety of people being released and those being transferred to other institutions that might face overcrowding. Among the necessary health care services should also be HIV and STI testing to prevent community transmission. And I hope that as the Health Commission, you'll take an active role in the plan to close down the Men's Central Jail in a way that is safest and healthiest for the community. Thank you.
Thank you very much. Lauren, is there another speaker in the queue?
Yes, there's one more speaker.
We will admit him right now. Good evening, speaker. You're on the line with the Los Angeles City Health Commission. Please state your name and the agenda item you are speaking on.
Hi, my name is Kabus from the AIDS Healthcare Foundation.
And you have 2 minutes to speak on a public comment or agenda item. Do you have an agenda item you are speaking on?
No, just general comment.
Okay, you have 2 minutes.
Hi, my name is Kathy Vu from the AIDS Healthcare Foundation. I wanted to speak on HIV and STD testing and treatment programs.
Please go ahead.
Hi.
Yeah, we can hear you beautifully. Thank you.
Oh, okay. So although COVID-19 is at the forefront of public health concerns, we cannot forget the importance of HIV and STD testing, treatment, and programs. Survey data and direct outreach show that public health emergency response to COVID-19 continues to disrupt mass-scale STD prevention and STD clinical services. STD programs, DIS, and clinical staff have resulted in reduced services, clinical capacity, and STD outbreak control efforts. So while these staff are currently eager to lend their expertise and time to the COVID-19 response, we are diverting additional resources and funds to these programs. So with STDs already at an all-time high, we cannot forget our importance of funding STD and HIV services as well. Thank you.
Thank you very, very much to the both of the members of the public who've presented to us, who spoke to us. We appreciate your questions, and we welcome all members of the public to come to our meetings and to ask questions and maintain their involvement. Lauren, is there any other people in the queue?
That was our last public comment. You may now proceed to the first agenda item.
Thank you very much. Seeing that there's no other members of the public that wish to be heard, we'll close public comment for this evening and go to our first speaker. And I'm honored and pleased to welcome Professor Alice Quo. She is an MD, a PhD, and she has an MBA. She is a full professor and chief of the UCLA Departments of Medicine and Pediatrics, also the director of the UCLA Center of Excellence in Maternal and Child Health, as well as an associate director of UCLA Preventive Medicine. She's one of the leading authorities on healthcare, kids, and schools. And since the pandemic has occurred, she's been a thought leader that has been advising people within the state of California and nationally. We are honored to welcome you to present and thrilled that you would make time available to join us. Professor Quo. It's all yours.
Goodbye. Thank you for having me.
Yeah, there you go.
Yeah, I'm sharing my screen as we practiced on Friday. It's grayed out. It doesn't let me share like on Friday.
Albert, are you on? Can you assist Dr. Quo?
Oh, here we go. Can you see? Okay. Hello, can you see? Can you still hear me?
Yeah, we see it.
All right.
We see it now beautifully. Thank you.
Okay, perfect. So thank you for the opportunity to present to the Commission. I know that this is a very sensitive subject, and you know, there's so much information to synthesize and to come to a conclusion that is safe for everyone. I wanted to thank one of my colleagues and former residents, Navi Yagane, who is an assistant professor in pediatric infectious diseases, for helping me to put this presentation together. I also wanted to mention that, I'm presenting on behalf of the American Academy of Pediatrics and not UCLA, just to clarify that. Okay, so the purpose of this presentation was to review the literature to inform school policies around reopening at some point. And what I'll cover is COVID transmission in adults, COVID transmission and symptoms in children, and a little bit of a summary of frequently asked questions that I have been fielding for the last couple of months. So just to reiterate, COVID transmission is thought to be transmitted through respiratory droplets. I know that there is the debate about airborne transmission, and it resurfaces every so often. It resurfaced recently, I think a week or two ago. And it's also to keep in mind, so respiratory droplets are, again, that the virus is in our secretions, so to speak. So, our saliva, our sneezing, mucus, when you cough. And so the virus is released whenever a person coughs, sneezes, or talks, and that can infect another person if the secretions come in contact with another person's mucous membrane, right? So the skin, the epidermis, is a good barrier, but our mucous membrane can transmit the virus into our bodies. And the infection can also occur if a person touches an infected surface and then touches their eyes, nose, or mouth on any of these mucous membranes. Typically, the droplets do not travel more than 6 feet and do not linger in the air. They also, in many studies, have not traveled more than 3 feet, so hence the 3 to 6 feet debate. I just wanted to put in a note about airborne, which is that the smaller the respiratory droplet is, the farther a droplet can travel. And so this idea of airborne is not to say that the virus can live in the air by itself. It still needs to be in a respiratory droplet, but that respiratory droplet is what can be airborne depending on its size. So when the pandemic hit the U.S. at roughly the beginning of March of this year, at that time, the idea of asymptomatic transmission was unclear. And the studies coming out of China at that time seemed to suggest that asymptomatic transmission did not occur. And so our initial guidelines from the CDC did not take that into consideration. However, as studies came out from Europe and also from within the United States, it became clear that pre-symptomatic or asymptomatic transmission does occur, and therefore contact tracing guidelines were changed to identify symptomatic individuals or potentially asymptomatic individuals 2 to 5 days prior to having symptoms. In widespread testing, as high as 56% of cases are asymptomatic, and I know that this is a concerning statistic to many adults and older adults, grandparents, about this issue of schools reopening. Transmission commonly occurs with prolonged duration of contact in close settings. So currently the guidelines from DPH are within 6 feet for more than 15 minutes. This is seen in healthcare workers, cruise ships, households. This is where transmission most commonly occurs. Hot spots that we've seen, not only in Los Angeles County, but around the country, have been, for example, meatpacking factories where workers are packed in an inside space who have to raise their voices, and therefore their respiratory droplets can spread farther because they're trying to communicate over loud machinery. And then also at parties, weddings, funerals, birthday parties are another common place for transmission. So an example of this asymptomatic transmission came from a very widely publicized case of a businessman from the United Kingdom who traveled to Wuhan, China for a conference, returned to the UK, and then immediately went on vacation to the French Alps. And there in the French Alps, he stayed with 13 individuals from 3 different families, and one family had 3 children, one of whom ended up testing positive. So this one individual who physically was in Wuhan brought the virus to the French Alps and infected 11 people in his group. So here is a, from the original article from Clinical Infectious Diseases, this is the contact tracing for those 13 individuals who subsequently were positive. The index case is number 1, and the child is number 9. And so you can see that the child, and dark blue means that they were in the chalet in the French Alps, and then the pale brown is when they went back to the United Kingdom, and one of the members even went on to Spain, so that's sort of the darker brown. So the lighter brown is the United Kingdom. So you see that child, the child number 9 was exposed to the initial contact on January 24th and started having symptoms on January 29th and left France to go back to the UK on February 2nd, and then was subsequently positive on February 10th. So between symptoms to determining that he was positive was roughly 12 to 13 days. This child, in the case of almost 2 weeks, went to 3 different schools. So had a main school, School A, it seems like a weekend school, which was School B, and then, or like a tutoring program, and then like an after-school program, which was School C. And had a total of, it seems, around 80 or so contacts, and none, which would have been considered high or low risk, and none of them contracted the virus from this child. So this is a situation where, again, child-to-child transmission appears to be quite low. This is another school contact tracing case that was described in Australia. This occurred in high school, and there were 8 students infected and 4 teachers in an entire school, and 863 close contacts were tested using both nasal swab, which is for PCR, which tries to identify the presence of actual virus particles in the body, indicating like an acute infection, and then antibodies. So blood samples were taken to check for antibodies, which would have indicated a previous infection or exposure. And out of these 863 close contacts, only 1 student was infected. So in primary schools, in the same report from Australia, there was a school that they did contact tracing on, and there was one student who was positive and 5 teachers. The student did not transmit to any peers or teachers, but there was 1 teacher case that transmitted to a student. So currently, in not only infectious diseases but child health policy circles, the conventional thinking at this moment is that it is most likely, if there is transmission that happens in the school, it will be most likely from teacher to student than from student to teacher or student to student. This is also borne out by data from the Netherlands that looks at the age of contacts who then infect other people. And as you can see, the likelihood of transmission increases the older the individual is. And on the right side of the graph, you see that most transmission in this study was over the age of 19. This is another study in Ireland where a total of 1,155 contacts from 6 positive children were identified. These were exposed during in school, in the classroom, during sports lessons, music lessons, during choir practice for a religious ceremony. Amongst the child contacts, there were no confirmed cases of COVID. Now, the only caveat to this study is that they only tested symptomatic contacts. So if there had been someone who contracted the illness and never had symptoms, we may not have identified them in this study. So internationally, schools have reopened. I know that the media has been very confusing with this information, especially as more attention has been paid to what is happening in our own country. But here, China has had great gradual reopening since March. Denmark opened on April 15th for children up to the age of 12. Norway opened on April 27th for grades 1 through 4. Singapore opened and then did close again due to a non-school related outbreak, and Taiwan was always open. They have small temporary closures as needed. Usually schools in Taiwan end at the end of June, and they are going into the third week of July because of small closures. When we look at symptomatology for pediatric patients, right now, pediatric patients, this is out of Italy, but this is very similar to what we have seen in our own country. Pediatric patients make up about 1% of all cases diagnosed. So this is one study in Italy in which 100 children were diagnosed positive between the days of March 3rd and 27th. 39% had a fever, which means that 61% did not. And 51% had cough and shortness of breath. And so this is, again, pointing to the difficulty with making this diagnosis just based on symptoms. And whether fever screening makes sense is, I think, up for debate. And 100% survive. So this, again, speaks to, in a healthy population of children, COVID is generally a mild condition from which they all recover. So MMWR published a study looking at our own data, and here we saw, again, 1.7% of all cases were under the age of 18. So this is looking at 2,500 children. 56% had no fever, which is similar to the Italy study. 73%, though, did have cough and shortness of breath. This is a little higher, and 99.8% survived. And those children who did not tended to be older and also with medically complex underlying comorbidities. By comparison, and I think this is where the pediatric community is trying to convey the sense that this is the new normal, influenza has been around for decades and kills 150 to 200 children each year in our country. Currently, COVID has killed in the double digits, so much less. A vaccine is available, it has been available, and it's been known and proven to decrease the odds of hospitalization and death, but only 57% of children between the ages of 6 months and 18 years each get the vaccine each year. And so I think the concern and the challenge and the conversation I'm having with families in my own practice is that this is going to take a while. Because if everyone is holding out hope for when a vaccine comes that we get to go back to pre-March conditions and live free, it may not occur quite like that. I think a vaccine will take time to develop. We'll have to see how effective it is, and then we'll have to see how many people decide to get it. And so I think there's a lot of challenges with that. Can children acquire infection easily? Many transmission studies, household transmission studies have been looked at from China, Europe, and I think one in the U.S. We in Los Angeles County are about to launch our own household transmission study through the LA County Department of Public Health. And in all the studies, it does seem to indicate that the attack rate for children, meaning the percentage of children who get infected, is lower than for adults. So somewhere in this range of a 5-fold decrease, where the attack rate for children was only 4%, and in adults it was 20%. And in another study here, 73% of the time parents had symptoms before children, whereas only 8% of the time child has symptoms first. So this is very much an infection that is thought to have a very mild course in children, definitely children under the age of 12. For children under the age of 5, it does seem to be almost transmission does not occur. So from a pediatric perspective, from our AAP experience, we are concerned about the indirect costs of COVID on children. We have seen decreased vaccination rates in the WHO, CDC, LA County Department of Public Health, California Department of Public Health. Everybody's a little bit worried about this because our vaccination rates have plummeted during March, April, and May, and now we're trying to play catch up getting those kids back into the office. We've also seen decreased well-child visits and sick visits for conditions that may need treatment. I've started seeing complications in children who have gotten hospitalized for conditions where they had come in for urgent care sooner. We might have avoided that hospitalization, but I think because of concerns of being exposed in our waiting room or in our clinic, parents aren't bringing them in. I'll let the educators speak to this, but poor outcomes seen with distance learning. I tend to treat a neurodevelopmental group of children in my practice, and so I can say for ADHD, I have increased doses. I have started children on antidepressants. And so definitely the increased mental health symptoms for children of all ages and young adults are concerning for the AAP, as well as the denied opportunities for social emotional development that come with play. Here in Los Angeles County, as well as across the country, we are also seeing an almost 50% decrease in the reporting of child abuse because teachers were the biggest group of reporters to DCFS. So we don't believe that the child abuse or neglect is not happening. We are just not being able to identify those children at this time. So what we know is that in general, based on these studies, children have milder respiratory symptoms and less fever. Severe illness can be seen very, very rarely, but mainly in medically complex older children and young adults. The acquisition of SARS-CoV-2 is less common than in adults based on household transmission studies. And transmission in adults is greater with prolonged exposure in a poorly ventilated space. And so I put that in there, just keeping in mind the teachers and staff that will be working in these schools. So what do we need to open schools safely? I had a conversation earlier today with some members of a supervisorial district, and I would say, I really hope that the framing of schools reopening changes from if and when schools reopen to how. How can we help schools reopen safely? Because I think it is indisputable that the best thing for children is a return to in-person education. And of course, we need to take into consideration our local context, but how can we help these schools do so safely? Because I do believe that we know enough about the virus to protect people in the school setting. What we need in order to do this is available testing for everyone with symptoms, teachers, staff, and students, ability for staff to take time off of work if they do have symptoms without any repercussions, monitoring of absenteeism, utilization of universal face covering for all staff and for most children, limiting the number of staff and adults allowed in congregate areas like the teacher's lounge and the kitchen, increased utilization of outdoor spaces because it does seem that this virus is not transmitted as much in outdoor spaces as inside where there's poor ventilation, hand washing stations everywhere. So, routine hand hygiene and wiping down of high-touch areas are definitely infection control measures that should be implemented. Decreased crowding, whether it's through keeping their desks apart or staggering opening and closing, will help. Fluidity to transition from distance learning to in-person and back, depending on what happens in the local context, as well as if there is a development of symptoms of either the teacher or student. And there's an understanding that this is not risk-free. I don't think in any situation could we make this risk-free, and so school-based outbreaks will happen, but what we need to do is to help schools manage those outbreaks as opposed to say, no in-person education whatsoever. What we don't know is, can we limit the classroom size to prevent congregating? I think there are a lot of people thinking about this, and I think there are strategies to do so. Decreasing the number of contacts makes it easier to control outbreaks. So I see this more as a saving your work on the back end once there is a positive or somebody with symptoms to do the contact tracing, as opposed to true prevention of infection transmission. Are interventions like temperature checks, masking of young children, and frequent asymptomatic testing beneficial? Based on the research that I presented and other studies, probably not. I know that this is controversial. I know that LAUSD superintendent seems to be very focused on asymptomatic routine testing, but in no situation has that come up in a clinical setting. At UCLA Health, we definitely have not done that. Will we see a rise in cases if we open schools up? It depends. I don't know. I think it depends on how well we're able to support schools in implementing these changes to keep them safe, as well as what's going on in the surrounding communities, right? So if teachers, as adults and parents are going out and not wearing masks and having increased rates of transmission, again, what is more likely to happen to a school is that an adult brings the infection into the school setting as opposed to a child. So we have taken a stand. I hesitate saying we take a stand. We want to work with public health officials to help schools to open safely and return to in-person education. I had a question today about whether the AAP backpedaled or rolled back our recommendation. I will say that's not exactly what happened. We put out these recommendations on June 25th. And then President Trump and Secretary DeVos picked it up, and they misrepresented what we said and said that the AAP thinks that students should go back to in-person school, without any other considerations, which is not what our statement says. So then our president, our national president, Sally Goza, as well as others in the AAP across the country, had to say, look, we agree that there needs to be support and safety measures put into place before children should go back to in-person education, but we still stand that we think that in-person education is better than distance learning. And in our statement, we advocate for that all policy considerations start with the goal of having students physically present in school and then accommodating if that is not possible due to the local climate. So some frequently asked questions I've been fielding over the past couple of weeks, utilizing outdoor space, what to do with lunch. Lunch comes up a lot and people are worried about what to do around lunch. It's not really about the food itself or the transmission via utensils or plates. I think it's really about children eating 6 feet apart or outside. So I don't know if in the school culture it's possible for children to return back to, their classroom to eat 6 feet apart. But even then, if, that's one way to do it. Another is to let them eat outside and ideally 6 feet apart. But at least if they're outside, that 6 feet may not matter as much. Recess should be okay as long as children have masks on. I think our infectious diseases colleagues have said for younger children who need the physical activity and so on, as long as they're wearing the mask, transmission should be relatively low. I do want to put in a plug for colleges and universities. I am at UCLA, and they are going back with a hybrid model this fall. The recommendations apply to older adolescents and young adults as well. I think we are actually very concerned about the mental health of this population. We already know that there's an adolescent mental health crisis in this country. It has not gotten better under COVID. And so, I would love to see our able to engage with colleges and universities for helping them to get back to in-person education safely. And then, the questions come, what if there's someone that's immunocompromised or grandma lives at home or all these different scenarios that parents bring to me. And I think ultimately, and what I tell them, is each family needs to decide for themselves how much risk they're willing to take if they send a child back to in-person schooling. Every family's situation is different. And so if there is a grandma or grandpa living in the home, if there are other seniors, if there are newborns, anyone with a chronic medical condition, I have seen results of parent surveys regarding going back to in-person education ranging from 50 to 80%. So I think it really depends on the community that they're in, their personal situation. And quite frankly, even if there isn't a senior or immunocompromised person or newborn or anyone with a chronic medical condition, I do have parents who just tell me that they're anxious and freaked out. That, Dr. Quo, we're going to do video visits until there's a vaccine because we are not leaving our houses. And so there is that. And, I think that because this cannot be risk-free, I think parents need to be given the information in a partnership way and be fully informed about what it means to go back to in-person schooling. And I have families in both camps. Some families for whom distance learning was no problem. Their kids are well behaved. They were able to do it. Mom doesn't work, whatever it is. And other families that are like, they're sending the kids back because that's the only way they're going to learn. And so I think that flexibility is really crucial, and that's why I think the big message of the AAP with our previous recommendations is flexible guidelines that do not implement a one-size-fits-all. I also wanted to point out that in the California Department of Public Health and Department of Education guidelines that were released last month, they did make a provision for face masks or, for younger children, face shields with cloth extension that tuck into the shirt collar. This is an example of, I think, what they were talking about, and we did identify a company that makes these cute little face shields for children called Vision Visor, and they did say that they could attach the cloth extension underneath that could tuck into the shirt to not have the respiratory droplets come out. I also wanted to share this resource from Orange County. They partnered with a company called 3D Event Designer for this Back to Business initiative, and they've actually been helping several school districts in Los Angeles County with their school site plans. And so this is the urban planning, or I don't know their background, design plus architecture plus space planning, but they customize a plan which will show how you could fit, if you took out all the other furniture in a classroom, and each circle here represents 6 feet of distance, spacing between students, you can fit, you know, in different configurations, anywhere from 20 to 24 students. And some of these, you know, schools that have bigger classrooms, it obviously depends on the classroom size, but they can mock it up and show you how many students you could potentially fit and still meet the 6-foot guideline. And so this is a little bit closer, where you see the red partition between the teacher and the student. So that can be a clear plexiglass partition to protect the teacher from the students and vice versa. And then there was a question about decreasing congregating at drop-off and pick-up. And so rather than looking at the hybrid model where nobody goes in person for a day as a way to decrease congregating, I think staggering start time, so this is just one idea where you see, for example, in the pink row there, you know, room 11 goes at 8 o'clock and then room 12 goes at 8:15. So presumably by staggering some of these times, you prevent the congregating in that area, you know, right before school starts, and also at pickup. I think that's it for my presentation. I'm happy to answer questions at this time.
I have a couple.
Sure. John, why don't you go ahead because you spoke up.
Okay, Doctor, thank you for your presentation. It's very informative. 2 questions. One, did the LA School Board and or the Long Beach School Board hear this material prior to making their decisions or today to not open in the fall? And that's one, and then I do have another one.
So I don't know about Long Beach. My understanding is some of my colleagues have presented this to LAUSD.
And they've made the decision thus far to say distance learning, I guess, in the fall.
Correct. That was announced today. I think in speaking to my board, we are hoping to, again, change it from distance learning for the upcoming year to, okay, they're going to start with distance learning because of the current conditions, but if we are able to improve those, what's going on in the county, maybe they will be open to opening up in person later on in the year. Like I'm hoping that it's not the academic year 2021 is all going to be distance learning, and that was decided today.
Okay, and then the other one is a separate question. Surface contact, which could occur in school quite a bit, notwithstanding they're several feet apart. Is surface contact, I mean, it's mentioned in your paper. I don't know how realistic or how dangerous that is, if you will. I know we are concerned about it at home when things arrive.
Sure. So so the first 6 weeks of the response at UCLA, I oversaw our response regarding healthcare workers. And I actually was on call for the first COVID case. I was on call for the first COVID employee. And then in May, I worked with a team from the CDC to look at site visits for nursing homes and was able to ask this question of them, right? So the surfaces. And the consensus is that high-touch surfaces should be wiped down for the purpose that I said earlier in the presentation, where it is possible that someone sneezes into their hand, touches the doorknob, and you come later, touch the doorknob, and then touch your mouth or whatever. So yes, this is transmitted like that all the time. So really, the recommendation is frequent wiping of surface areas, but the focus is really high-touch surface areas. You know, if it's one student's desk and that student only works at that desk, then wiping it down at the beginning and the end of the day is not a bad idea. But more importantly, it's the doorknob, it's the water faucet handle, it's the sink handles. You know, I know that schools are talking about implementing, you know, touchless soap dispensing and things like that for that reason. You know, the paper towel dispenser, if you have to touch it, then that everybody is touching it. Those are the areas that really should be wiped down, you know, frequently to prevent that scenario where someone coughed into their hand, then touched it, and the next person who touches it has the potential.
I'm a little concerned about the kid that brings a ball in or something that gets passed around the room. But you know, anyway, thank you very much. It's been informative.
Thank you, Commissioner Hissrich. What I'll probably do is I'll ask questions first, and then I'll go through because I can't see all the commissioners' faces on the way the Google map. I'll just kind of go alphabetically. I think that'll work better. First, I want to thank you for a thorough and very, very complete presentation that's very fact-based. The Children's Hospital of Los Angeles is one of the largest children's hospitals west of the Mississippi. And in our county, the most populated county in the country, Children's Hospitals only had 330 total admissions of kids since the pandemic began, averaging 4 to 5 kids, and currently only has 6 kids that are in the hospital with COVID positive. And most of those kids are not there because of COVID, but because of other diseases, but have COVID as well. And only 1 child is currently in the pediatric intensive care unit. Do you have similar numbers for Mattel Children's, or have there been issues at Mattel Children's that you are aware of?
No, so I did have an opportunity to ask one of my pediatric infectious diseases colleagues. They've only had 50 cases total since the beginning of the pandemic, and only 10 required hospitalization. So we've only had 10 hospitalized children, and none of them were sick due to COVID. They were all incidental findings when these children were hospitalized for something else. So we have not had a problem with COVID at Mattel.
Right. So I think that's an important point for the listeners or for educators or for the leaders, both the city council and the mayor, in that in the most populated county of America, in the 2 leading institutions with academic connections, we have had really not very many students or individuals either admitted or impacted dramatically by this. So the issue really is not one where the kids are going to get sick, but we really have to focus on protecting our teachers, staff, and other professionals that are within the school system, because it's not really necessarily a major problem for kids. Clearly there is a balance between risk and reward, but we're causing risk to kids also from mental health points of view, and as you pointed out so superbly in your presentation. You used the term framing in your discussion, and I think that's an important one for the public as well the commissioners to realize. There's a professor at UC Berkeley, George Lakoff, that wrote a book 20 years ago that's called Don't Think of an Elephant. That is all about speech and framing. And when I said don't think of an elephant, you're all now in your brain have a little picture of this dancing little elephant. It might be different colors, but the fact of the matter is I planted this concept of an elephant in front of your face. And I think it's important for us to understand how framing impacts people. And I'll give you an example from my own field of OBGYN. In the mid-'80s, it was found that the human papillomavirus was linked to causation of cervical cancer and other female cancers. And we knew that there were certain DNA types of high-risk HPV. There's approximately now we know about 187 subtypes, but only 14 of those cause cervical cancer. And how do you present data to a patient who comes in with a positive HPV high-risk test? And I'm going to give you some information and present it in 3 different ways, and I just want the public as well as all the commissioners to kind of think about it. These are all true statements. If you have a positive high-risk HPV DNA, you have a 100% increased chance of developing cervical cancer in your lifetime. Second is, if you have a positive HPV DNA, you have double the risk. And lastly, if you have a positive HPV DNA, you have a 1.7% increased lifetime risk of developing cervical cancer. They're all 3 are true statements, and the reason for that is that the risk of getting cervical cancer in the general population is 1.7%. If we have a knowledge that you have a positive HPV, it goes up to 3.4%. That's a double. It's also a 100% increase, okay, and it's also a 1.7%. So I can present the information to people, and we have to be very cautious and careful that we allow healthcare professionals and public health people to present the data in a way that's understandable to individuals so we don't react to fear and we don't react to panic. As Roosevelt said, we only have fear to fear. Paraphrasing, obviously. So going to the point, in your presentation, as you mentioned that drop-offs of students coming and going to campuses is an area where there's more congregating, obviously, and though we would all like to believe the kids are going to stand 3 or 6 feet apart, if you've ever been at any drop-off ever with a school, that's not what happens. Kids haven't seen themselves since the night before, or if it's going to be hybrid days before, they're going to not necessarily follow rules. Kids, we know, don't necessarily follow rules. So theoretically, wouldn't it be more sense to not only stagger, as you wisely recommend, drop-offs and have multiple sites for drop-offs, but in addition, maybe to think about going to 4 full days of school, where the school days are a little bit longer, an hour, hour and a half, but only have 4 days, which we then are limiting by 20% the risk exposure to the faculty and to the administrators, but additionally have less risk because, as we have just learned from your excellent presentation, there's a much higher risk of somebody bringing disease into the school from the community and not the other way around. And that by limiting it to 4 days, we can get all the education done in a proper manner, yet decrease the risk by another 20% with a simple thing as just going to a 4-day school week, which would help every individual. Additionally, because there will be issues with the inability to do singing or music or some sports, that we get a 5th day free where students in the privacy of their own home or the local communities could go jogging or running or hiking or sing in their backyards or on the street and not necessarily risk other individuals. Could you comment on that?
Sure. So a couple of thoughts that I have. One is that, as I mentioned, many surveys, especially in the higher SES or the more affluent areas, have indicated that up to 80% of parents are willing to send their children back to in-person education, provided that there are safeguards in place. And so I think in many of the smaller school districts, they've already anticipated a 20% decrease in student population on campus. I think there has to be distance learning available for some proportion of the population, and it's probably around 20%. So you're already going to get that decreased number. I think going to a 4-day school week is an interesting one and probably feasible in, again, the higher SES, more affluent school district. I think for places like LAUSD, where there's a high percentage of children that rely on school meals and may not have access to playgrounds or parks or safe places to play on that 5th day, that it might not be as good of an idea for the lower income school districts or the lower wealth areas. And I think your example or my response sort of underscores that each school district needs to figure it out and make the sort of the adjustments necessary to get the highest number of students back to in-person education as possible. So LAUSD is not going to look the same as Las Virgenes or Long Beach or Manhattan Beach or, any of these other areas, and that's okay. So, I have already seen today with the announcement that we not return to in-person education, some superintendents are like, oh, well, we all have to adjust our plans. And I'm like, well, why? Just because LAUSD decided that, if you were on track with hybrid education, like, go for it. There's nothing, I don't know if it's sort of, superintendent, competition or something. But in the end, I think the model that works the best for LAUSD probably is not going to work for everyone else, because we are dealing with 600,000 students and such a high proportion of, poor or lower wealth areas. And have other considerations that they need to take into account that Las Virgenes and Manhattan Beach do not have to. And so I think that again, encouraging flexibility, encouraging and helping each district with the support necessary, whether it's from our medical community, whether it's from public health, whether wherever they can get the support. To open safely is the priority, and if it's 80 different models, then that's okay.
Wonderful, thank you. So let me go through, I'll try to go alphabetically. I think that might work better. Commissioner Avia, do you have any questions? You'll have to unmute if you're going to ask a question. Hearing none. Commissioner Estradas, do you have a question? Lorraine, do you have a question? No? Okay. Commissioner Grimmig, you had questions.
Yes. Thank you for the presentation. It was very illuminating. I have a question in regards to some of the studies you had referenced out of the Netherlands and out of China. And I was wondering, I know at least one of them you said there were no studies looking at, or at least in the study they didn't look at asymptomatic patients. Was that the same in all the studies that you referenced, that none of them looked at asymptomatic transmission in children?
No, just those ones that I mentioned.
Just one. So some of the studies did look at asymptomatic patients. They tested everybody, basically, to see what the transmission rates were. Yeah. So my next question, not to put you on the spot, but do you know why would it be the case that children don't transmit the disease between each other versus people over the age of 18, where transmission seems to be easy, and as you get older, it becomes easier because they have the same mucous membranes, they transmit it the same way you think. Why would it be the case that the children don't seem to pass it to each other?
Yeah, so, I mean, the scientists are working on these studies, and a popular theory right now among circles is that the coronavirus attaches to a receptor called the ACE receptor. And the receptor that the coronavirus attaches to is practically non-existent in children under the age of 5 and immature or underdeveloped in children under the age of 12. So they haven't yet proven this, but that is a popularly held theory in infectious diseases, which could explain why the coronavirus is not seen to affect children in this way. So as you get older, that receptor is more mature, and then the coronavirus has an opportunity to attach and then infect you. Obviously, the rare cases of children getting it could indicate that maybe they had mature receptors or different physiology. And then in cases of children who are extremely compromised or medically fragile who have gotten the virus, their immune systems weren't able to help the virus stay out. So if the body is overwhelmed by the virus, maybe it overcomes the immature receptors. I think it's a reasonable theory. My understanding is we have not seen any transmission of virus to newborns. So we have had babies born to almost, I would say, 200 pregnant women in Los Angeles County, and none of the babies have, 200 pregnant women who were positive for COVID at the time of delivery, and none of the newborns have contracted COVID, which is great, which is very reassuring. And so, again, I think there is, increasing evidence, and in some ways, I think we need time. I think there's so many studies in process right now and getting started that I think in a year, we're going to know a lot more. And, if we aren't able to get all of the schools in person this academic year, my sincere hope is that we will have enough scientific knowledge by next summer that fall of 2021, we can get pretty much most of them back if possible.
Commissioner Grimmick, also you should look at studies that were from UC San Diego Institute, as well as in Scandinavia, where they looked at both T-cell memory as well as partial immunity from other coronaviruses. Kids, because they've been in school for a good number of years, have been exposed to other coronaviruses, and there appears to be some immunologic benefit to having some circulating antibodies that in the test tube will actually decrease the infectivity. And so the Scripps Institute has done a lot of work on this. And if you take blood from people who have not ever seen coronavirus COVID-19, but have other antibodies in them, and you put this virus in, it does coagulate and precipitate out. So it's possible that because kids are so exposed over the last number of years from being in school and other areas with other coronaviruses, that they have some immunity. That's the theory also behind why, if you look at Hong Kong and also in Singapore, where 15 to 18% of the population were affected by the SARS virus, that their spread was much, much, much less than, say, a city like New York, even though the populations of those two cities, Hong Kong and Singapore combined, are like 8.7 million people. They had much less spread. Same thing with antibodies to SARS virus, which is another coronavirus. Those people have partial immunity. And partial immunity will protect you to some degrees, and that might have a role. We'll learn more, obviously, but there is a lot of research going on that there. Matt, did you have another question?
No, that's it.
Commissioner Kalani?
I do have a question. Some several studies. Think about investigators when you think about the large numbers of folks of color who have been impacted. I'm just curious, but all the studies are what you shared are really examples in more fluent areas. So what's the thinking or what's the consideration, from a more kind of a racial equity lens when you think about underinvested areas? Many of those are in LAUSD. So although you talk about there's not, low incidence of students, but when you think about adults that are teachers, cafeterias, janitors, security guards, folks of color living in communities, what's the thinking or recommendations in terms of safety in those situations?
Yes. So clearly, I think communities of color are sort of hit double with this issue, right? So our students that live, who come from those communities, really need education and need schools to be that protective factor, right, to support them and to help them try to break the cycle and so on. So it is even more important for them to return to in-person education because I think there has been variable uptake of distance learning and whether homes have Wi-Fi and, tablets or laptops for each child as opposed to everyone sharing. And so clearly, I think, school districts who serve those communities have different considerations. And I think this is what is meant by the local context, right? So it's the same transmission principles apply, in that if there is a high burden of coronavirus that is present in the community outside the school, where teachers and staff and parents are working and interacting, someone will bring the infection into the school. And so I think that is the understanding of why the Department of Health is concerned about schools returning to in-person education, because when there is that high burden. And ironically, the reason for a high burden of coronavirus in communities is different in communities of color and lower income communities compared to affluent areas, right? I mean, both of them are suffering from high rates of coronavirus burden right now in the county. But I think in the more affluent areas, you are seeing sort of a willful disobedience, sort of parents not wanting to follow guidelines. It's not because they can't afford a mask. It's not because they don't want to. They have the privilege of being able to order grocery delivery and things like that. I think, the discussion and the debate in the more affluent communities is, I'm going to do what I want to do, and I'm going to go to the beach, and I'm not going to wear a mask. And, this is sort of what I see in one side of the practice. And then on the other side, when we work in our lower community, communities of color, lower income communities, I mean, I think it's a lot of access. It's a lot of even information not getting out to some of the Spanish-speaking community. I think, as much as things are trying to be interpreted, I think sometimes it's a little bit different. And I think that, the traditional issues that plague communities of color are still at play. There's less access to health care. There's still less access to supplies and understanding and support for businesses to implement some of these measures. And so definitely more attention needs to be paid to those schools in order to open safely. I still think it could be done. I think it's just a matter of, getting all the ducks lined up in a row, the resources, the training, the support, the money, all of it together, so that these schools can open more safely. But to some extent, that is where the priority should be, because those are the kids who need it the most.
Do you have another question? Or so for members of the public who are hearing this, our March City Commission meeting had one of the presenters, a professor from UCLA, who discussed this in great detail. It's a wonderful discussion that goes on for about 40 minutes. It's on YouTube. You can check it out and see. Clearly an area that we as a city need to address, and this commission has pledged itself to address going forward. I appreciate the Commissioner's question. Commissioner Sirota, do you have a question? Commissioner Sirota, do you have a question? If you do, have it unmute, please.
No, I don't. Thank you.
Thank you, Commissioner Sirota. Commissioner Cotto, I think you're next up.
I think I got skipped if you went alphabetical order.
I did, but the way the alphabetized works on this Google, it's by first name. I apologize.
Okay. Yes, I do.
Didn't create the Google. I didn't create the Google. There's some other people that created the existence of Google that are doing a lot better than all of us combined.
Yes, I could truly understand the importance of the mental health for the kids wanting to go back, but I'm sure you heard the results of the LAUSD Teachers Union survey, where 83% of the teachers, they didn't want to go back. And, I think for them, they're the ones that are going to be responsible for wiping down the surfaces. And, right now we're hearing news that with the second outbreak, hospitals are in dire need for PPE equipment, which is going to require bidding and, increase the prices. And, I really wonder to what extent LAUSD would be prepared. And you're talking about, training for the people from the, the lower income community, but there has to be this training for the staff to be able to feel safe as they're teaching the kids. And we're talking about utilizing outdoor space. It's fine right now when it's hot, but as we get towards the winter, if it starts raining, everybody's going to be indoors. And, what would be like guidelines to keep everybody safe in those circumstances?
Well, and I think that these are great questions, and these are the questions the school districts need to work through. I think, having worked with school districts of all different sizes, even in a small school district with 5 elementary schools and 1 middle school, I think a phased approach with one school with maybe, an energetic principal and the teachers willing to come back, have them try it out. I can say from managing the response at UCLA in the beginning, it is scary. Like, I have not taken a day off from work since the pandemic started. And that was, many months ago. And so I go in when I have clinic, I'm going in. I mean, I guess I'm considered an essential worker. And I think the challenge for teachers is to get their minds around the fact that we believe they're essential workers. We need them. We need them to educate our children. They're a profession that we need to protect in these cases. And so, as far as, bidding for PPE, yeah, that's always going to be there. And I think more money needs to come to the schools. And my understanding is at the federal level, there has been discussion with the Trump administration on a bailout for schools in order to give them money to either build more classrooms or hire more teachers and staff. I mean, definitely there needs to be more money and resources, and not from California because our schools are all very underfunded. So, from the federal government, I think there is alignment with educators and health advocates to say there need to be more resources if we want schools to return in person, and that is the goal. That needs to be the goal. But, what happens when it's raining? Maybe if it rains, everyone stays home. I mean, that's a rain day, similar to a snow day. I don't know the answer, but they're answerable, right? It's just a matter of coming up with plans, trying it. If it works, great. If it doesn't, try something else. And I think there seems to be, to me at least, the conversation in the media and in the administration is sort of like all or nothing. We're either going to open or we're not. And that's why I say let's reframe. How do we help you feel safe to open up in person? Teachers are in the same boat as the parents. There will be some teachers that recognize and love their students and want to come back and understand that in-person education is the best thing, and they're willing to take the minimal risk if we give them a face shield or a face mask and we build a partition to make sure that no child steps up on, kind of climbs on them or wants to hug them or whatever. Like, if we can train the students to do that and we put safeguards in the classroom, I think we can actually make it happen. And those teachers, similar to nurses who decided during the pandemic, like, this is the time to retire, maybe that's what has to happen. Maybe some teachers decide, this is not for me, this is too much risk. I have a condition, someone in my household has a condition, I don't want to take that risk, and they may become a permanent distance learning teacher or a tutor or something. There is going to be an adjustment that occurs, similarly to there was when the healthcare workers had to do this, right? And so I think this is all part of learning to live with COVID, learning to adjust to the new normal.
Well, thank you, Dr. Quo, for sharing your expertise and for the time that you're taking with us. Thank you so much.
Sure.
Commissioner Ossie?
Yeah, so I did have a question related to any projections that may be circulating around how a child or adolescent may respond to both the SARS-CoV-2 and the influenza virus during the influenza season?
Yeah, so that is a concern that people have. My understanding, I don't know too much about it personally. I can definitely ask and get back to you. But there is a significant concern amongst pediatric infectious disease. Oh, I mean, I think it's not just pediatric, anybody. The co-infection of influenza and coronavirus has been very rare, but they are seeing it, and I think it does indicate some more severe disease. And so I know that the Vaccine Preventable Diseases Unit is hoping to launch a significant flu vaccine campaign, and all of us in healthcare, we are mandated, we have to get our flu vaccine. And so I hope that our flu vaccine rates this fall are the highest we've ever seen, because this could potentially protect you from a co-infection or a situation where your body is weakened from influenza and you get a double hit with COVID, and then who knows what's going to happen, right? So separately, for the most part, both are considered milder respiratory infections in healthy individuals. But, when influenza can be very widespread, and, we have the flu watch every fall, you see that cases start to go up around December, and they peak around the end of January, and they start to go down around March. This fall, this winter could be a very tough season if people do not get their flu vaccine.
Commissioner Ossie, do you have any other questions?
No additional questions. Thank you.
Thank you for your question. Commissioner Shannon, do you have any questions?
Yes. First of all, thank you so much, Dr. Quo, for speaking to our commission. I am a parent, actually. My daughter is in LAUSD. Over the summer, she was supposed to go to camp, and they did not open the camp except for a few days. And then they had the kids come, and then they realized that the children were not social distancing, and then they had to close the camp down. So I do know that it's very difficult for children to be able to social distance, so that's definitely one of my concerns. But I wanted to go back to the discussion on communities of color, particularly in low-income areas. What we're seeing, and this is just, I'm not looking at studies, I'm just looking at articles that I'm looking at that are in newspapers, but obviously communities of color, particularly in low-income areas, are getting hit fairly hard and disproportionately impacted. And so I understand the education disparities, but I just wanted to go back to the thinking here, because it seems like if there is less testing in those areas, less PPE or access to PPE, it just seems like in those communities in particular, going back to school is going to lead to even higher transmission rates in low-income areas. So it seems to me like that would be an area where we would want to pay even more attention and maybe have students coming back later as opposed to earlier, as long as we can, figure out, as you said, like the internet connections that are an issue, and also the free meal program. So I'm wondering if we could just revisit that again in terms of the sort of logic and thinking, just from the perspective of the higher transmission rates in these communities of color, in low-income communities in particular.
Yeah, I mean, I think it's a difficult conundrum. I do, as I mentioned, I think communities of color are double hit. But I think that, recognizing the disparities that communities of color face in acquiring the appropriate supplies and materials and things like that, I think it's a matter of which strategy you think is going to lead to a successful outcome, right? And rather than saying, well, it's always going to be hard for communities of color to get the stuff they need, so they should just wait, it's not quite the message I think we should promote. And I think, as I mentioned, those students are the ones I'm worried about. I am not worried about students in Manhattan Beach or Las Virgenes or, you know, South Pasadena or any of that. I am worried about the students in low-income communities the most. As the director of maternal and child health at UCLA, like, that is what we care about. That is what is the concern. And so, to the extent that prioritizing them to get back to in-person education, you know, in whatever way that it takes, if it means making sure they get the equipment first, making sure they get the supplies first, like, that should be the direction of the prioritization rather than they should go later because their communities have difficulty. And, you know, understood that, you know, getting everyone Wi-Fi is easier said than done. So you know, so it's a risk, it's a very tricky risk benefit balance that we're looking at. And so my hope in the presentation was to show that transmission is low. I mean, yes, transmission from child to child is low, and infection of children is low, okay? So if that is the case, even if the kid is exposed to COVID or gets COVID, chances are they're going to have a cold, like a mild cold. And so that, if that's the outcome of kids getting COVID, and the risk of staying out of school is a ton of bad things, then maybe it's better to prioritize getting them back into school, even if there is a risk of COVID, right? So from the pediatrics perspective, the kid perspective, it seems very clear, at least to me, that the benefit of going back in person far outweighs the risk of getting COVID for children. So then you have to deal with all the adults in the school setting, because I think even if, you know, the kids are good, clearly the adults are the ones who are freaked out. So teachers, staff, custodial, food services, all of that. And that's where, you know, and definitely the children outnumber the adults. Like, you know, it's like 4 or 5 to 1, the number of children on a campus than adults. So then all the effort of the district should be at how do you protect the adults? Partitions, face shields, you know, wipe down, figure out how they're going to eat lunch without all going to the teacher lounge at the same time. Like, all of that needs to be worked out. And then I think that, you know, that is what we should prioritize. And, you know, the biggest concern in infectious disease, based on what we know that schools can open safely. Like, we know enough to support them in opening safely. What many infectious diseases experts are concerned about is that schools will become a scapegoat. If there is increased transmission in the community, people are going to blame it on the schools. When it is community transmission that is resulting in that, and schools are sort of like a secondary effect. But because this issue has become so politicized, and people want to open schools and don't want to open schools, and teachers union, you know, everything that you guys mentioned, that it's a very muddy situation. But I hope that clarifies sort of what I was thinking around the communities of color, why they should be prioritized for opening as opposed to later.
Yeah. So I have another question. For adults who work in a school setting, teachers, administrators, janitors, and they may be in a vulnerable population, so seniors or immune compromised, do you feel like there could be protocols in place for that particular population? Or do you think that, like, the distance learning, or in this case, distance teaching, obviously this wouldn't apply to janitors, but to be able to do their job remotely would make it much more safe, you know, because I'm not sure, you know, if you can explain to the partition, and if this is something that, like, is in other countries, or there's been modeling around that in terms of keeping adults safe, you know, who may be in one of those vulnerable populations.
Right. So I think in a school setting, there's definitely a difference between teachers and everyone else. So teachers make up a fraction of the adults on campus, and it takes a lot of other people like aides and you know, cleaning staff and you know, admin staff and food services, all of that. And so teachers have the opportunity to do distance learning, and clearly I think that's where the teachers' unions are coming from. I think that, as I mentioned, you know, districts have already invested tons of money in trying to make teachers' homes more home office-y and giving teachers Wi-Fi and laptops and things like that. I think that if students are not on campus, there is no reason that the teacher needs to stay home. The teacher can be alone in a classroom and do distance learning from the classroom. And so I think that that is, you know, that is something that can be considered. So, you know, I think when it comes to sort of the human resources implications, I mean, there are definitely others way, way more versed than I. There's contracts and things like that. But yes, there needs to be some flexibility, as I mentioned, for teachers that they not come to work symptomatic. So if a teacher wakes up with a scratchy throat or something, we want that teacher to stay home. The difference in their ability to do distance learning is that with a scratchy throat, they potentially could teach from home. So I'm not sure how that works, if that's a sick day or not. When we had nurses or doctors with a scratchy throat, we said, stay home and don't work and you can't come. Like, you cannot come to the hospital. And that was a huge culture change. You know, there's a culture of presenteeism in many professions where you work through a low-grade fever, you work through a sniffle or a sore throat because that is what is expected. And that is the hardest culture change to make in this era of COVID, that we don't want you to work, even if it's a sniffle, even if you think this is just hay fever or allergies, you know, unless you know for sure, or unless you can, you know, you and your doctor have worked that out, you know, a sore throat really needs to be COVID until proven otherwise. And so for teachers, I think there's a lot of challenges figuring out what they can and cannot do and whether it is safer for them to stay home. I would say that it's safer for everyone to stay home. But if we're saying that teachers are essential workers, we need somebody to come and teach, whether it is a teacher or a substitute or something. For the staff, and this is my biggest concern at UCLA, I mean, the problems with the staff is that everyone overlooks them. So everyone thinks of teachers when they're in school, and they don't think about the cafeteria workers or the janitorial staff or things like that. And inevitably, there will be an outbreak, and oops, because that wasn't taken into consideration. But then you fix it, and you learn from it, and you realize, oh, we need signs. We need the staff to have this. We need to make sure they understand that. You do training. So no school district is going to get it perfect from day one. No school district. But I think they should do the best they can, launch the plan, pilot it in one school, pilot it in a subset of schools, and learn from it and improve and open more schools. So I think there is a phased approach that can get to the eventual goal of in-person education for all the students that want it, because my fear is that we are looking at this for a while. You know, there's no timeline on when we're going to get back to what we had before. So if this is what we're stuck in for a while, I think we're going to have a generation and so much learning lost that we're really going to have issues down the line.
And then one last question. In a hybrid model, do you think it should be optional for students to come to school so that maybe some children come to school and others are like, you know, watching it, you know, from the internet, from their home, and not mandatory?
I don't think any district is considering mandatory in-person. So all the plans that I have seen from a dozen or so districts have indicated one option is 100% distance learning, and then the hybrid is another option. And they're asking for parents to choose one or the other. And while they say that parents can change their minds, I think they're looking for at least like a minimum of a semester commitment. So, you know, if you started out distance learning because you didn't want to be an early adopter and you wanted to see how it went before you decided the hybrid, you could make that decision someplace, at some midpoint in the school year and similar. So I have not seen anyone mandate return to in-person education for the reason that I said before, which is every family has to decide based on their own situation, if there's a grandma and a grandpa at home, or medically complex, or newborn, or just freaked out, anxious, ain't doing it, So I suspect that every district will have probably around 20% fully distance learning for that reason. And if it matches with their teachers who don't want to go back to teaching, then you've got teachers who are going to be managing that.
Great. Thank you.
No problem.
The other thing to realize is that kids do get colds. Kids do get sick. And so in the time of COVID, if a kid gets a low-grade fever, that kid should not go to school.
Correct.
And that has to stay quasi-quarantined at home. So we need to have a backup that includes some distance learning for those kids, because even though the overwhelming majority, probably 98% of those kids, 99% of those kids are not going to have COVID, we can't let a kid that has a cough or a runny nose or other symptoms or fever above 104 to walk into any school within the city of Los Angeles. That would be inappropriate. So we need to have the online alternative going. The problem that we're going to have is we're not talking about a short-term issue here. The studies show that kids who fall behind in the early grades, they don't play catch-up very well, and they end up having problems, and they have a significantly higher dropout rate. You drop out of high school, you end up in poverty for the rest of your entire life, and it's generational. If you drop out of high school and you end up in poverty, your kids in the future, in the next generation, are starting off way behind the eight ball, and they have less chances of getting ahead. So this is not an issue just for this season or next year. This is a problem for a generation or two of Los Angelinos, and we have to do it right. If we can put a man on the moon years ago, decades ago, we could protect our teachers and our staff in schools from catching the virus and spreading the virus. We have excellent hospitals in the city of Los Angeles and the county of Los Angeles that have not had spread of any significance to their faculty, to their doctors, to their nurses. At the Massachusetts General Hospital, which is a massive referral center in Boston, that they were flying in COVID patients from all over New England, they didn't have their doctors get sick. The majority of the people who got sick that were employed by the hospital, they tracked them. They got it outside the hospital. They didn't get it inside the hospital. We can protect our professionals. And that's our responsibility as a commission to advise the city council as well as the mayor to protect that this is a responsibility. We're not being imprudent. We can't open up if we're not going to protect people. On the other hand, if we don't protect people, we're going to have generations of Los Angelinos who are going to have a deficit. And that's inappropriate and imprudent and not good public health either. Commissioner Whittington, do you have a question or two?
I do have one more when you get a chance.
You have to unmute, Yolanda.
Sorry.
Ready?
No, I do not. Thank you.
Wonderful. Thank you.
I just wanted to ask Dr. Quo, we heard a lot about Kawasaki syndrome for a while, and that seems to have faded. What's the status of that?
Yes, so the multi-system inflammatory syndrome in children, called MIS-C, it is apparent, they're still studying it, let's put it that way. There are fewer than a dozen cases in LA County going into the epidemic. We have not had many cases at all. And so it is a condition. It is probably going to end up being a Kawasaki variant or similar type of findings, but it's super, super rare. Right now still being studied. Like, basically, we're still trying to identify enough cases for the CDC to do its studies, to try to understand it better. But again, in LA County, it does not seem to be very much of a problem.
Thank you.
They studied that in Switzerland and in France. They looked at every single admission to a PICU. And if you look at the populations of kids under the age of 18 in those two countries, it works out to be approximately something in 1 in 20 to 1 in 30,000 kids were impacted. If you look in New York City, it's a little higher. The demographics are a little bit different. It's more like 1 in 10,000 to 1 in 20,000. So it's not a big issue. The most important thing for some communities to look at is the number of PICU beds. Even though most of these kids, if they're treated with steroids early, don't end up in the PICU, you need to have the backup of having pediatric ICUs. LA City is blessed by having some of the best PICUs in the country. It's not true of other communities, and I think this is what Dr. Quo is teaching about, is that every single community needs to look at itself. In some areas, they're pretty far. They don't have PICU beds. Those have to be much more cautious and include that in their algorithm to when to open or how to open. In a city like Los Angeles, we're blessed by having capacity in the PICUs, so we shouldn't have to worry about that. Are there any other questions from any other commissioners? You could just jump in because I can't see you all. Well, hearing none and seeing none, I want to thank Dr. Quo for coming to present to us. We're honored and blessed that you would take time out of your extremely busy schedules to come to educate us and the people of Los Angeles. We look forward to working with you in the future and continuing to work with you. And we truly, truly appreciate your superb presentation today. We have another presentation. You're welcome to stay on, or you're also welcome, given your busy schedule, to sign off. We truly appreciate your efforts. Thank you.
Thank you for having me.
So moving on to the second part of the agenda, I'd like to introduce Arturo Valdez, who's Deputy Superintendent of the Los Angeles County Office of Education. Superintendent Valdez, please do your presentation.
Thank you so much. Can you hear me clearly?
Yes.
Okay. Thank you. Again, the name Arturo Valdez, Deputy Superintendent with LA County Office of Education. First and foremost, two things I want to say that I want to make sure that you remember in my presentation. Number one, that at the County Office of Education, we believe that students should be back at school. And we believe that they should be back at school in the safest manner possible. And number two is you cannot equate distance learning with in-person learning. That just doesn't equate whatsoever. And so we clearly know that there are humongous benefits to having kids in class versus distance learning. Now, having said that, just a little bit about LACO so you understand. In LA County, we have 1.5 million K-12 students. We have 2 million students if you include early education and adult education as well. We have 80 districts, as you know, in LA County. We have over 2,000 schools. We have 362 charter schools, and we have over 73,000 teachers in LA County. Now, of that group, it's important to know that we have 67,000 students that are experiencing homelessness in LA County. We have 30,000 students that are in foster care, and we have over 182,000 that are students in special education. We have over 272,000 that are English learners, and 7 out of 10 students are socially, economically disadvantaged in LA County. So that just kind of gives you a little perspective as to some of the challenges, yet some of the things that we look forward to working with on a daily basis. LA County is the largest county in California. It has 1/4 of the student population, which is 6 million in California. We have 1.5 million. And what I wanted you to know is that we're currently, today was a very banner day in which at 11 o'clock, as you know, LA Unified made the decision to go 100% online learning. But previous to today, we had 10 other districts that had already committed to going online learning before LA Unified, and we will have much more after LA Unified. One of the issues that comes up that when LA Unified makes a decision, why do you need to follow it? There's two reasons for that. Number one is unions. The unions are all organized throughout California and nationally, as you know, but also in LA County. As the unions begin to hear of schools going distance learning and those options, they really put a lot of pressure on the school boards and the superintendent. The other group is parents. And as parents hear that other districts are doing ABC, they also want to advocate for their districts, and there's a lot of pressures that they also put on a lot of school boards and a lot of superintendents. It's important to know that the decision for what model ends up coming out is 100% on that school community and on that district. That Dr. Ferrer or Superintendent Dr. Deborah Eduardo from LA County Office of Education, they do not make those recommendations. That is something that should be absolutely done locally. So you know also that today at 12 o'clock, Governor Newsom came on, and looks like we have tightened up some of the parameters that we had as far as opening throughout California, in that we're closing a few things. So that does not paint a positive picture. And then today, also at 1 o'clock, we finally have gotten the protocols for LA County Department of Health for K-12 schools. So that is extremely important, the latter of what I just mentioned, in that that is the blueprint for how schools are to prepare for reopening. So issues of physical distancing is 6 feet. And in the classroom that we've estimated at an average square footage of 960 feet, there is no more than 12 to 14 students in that classroom. That does not include the teacher, so there has to be special provisions for that teacher. Face coverings are going to be mandatory for anyone over 2 years old in a school, unless there are special circumstances. And temperature taking is going to be where needed or when feasible. Disinfecting, of course, has to be done nonstop, and that has to be the high-touched areas that we had talked about earlier. You know, we are advocating and asking all schools to have all their doors open or propped open so that no one has to touch a door handle anytime during the school day. We are also looking at less kids on campus, because I want to let you know that before maybe 2 weeks ago, we had 100% of the districts that were going to go on a hybrid. Very few, if any, were going to go 100% in person. Again, 99% were going to go hybrid, I believe. As of today, that's changed completely, in that more and more districts are looking at full-time distance learning to start the beginning of the school year. And that has changed a lot in relation to the requirements that have come out from Dr. Ferrer, but also some of the data that's out there, some of the unions advocating, and some of the concerns from the parents as well. We have multiple options for kids. There are kids that are going to want to stay home, or parents that are going to want to have their kids stay home full time. That's available. We have parents that are going to want their kids at school full time, and that might also be an option. And then we have the hybrid model, where some kids will have to spend some of the times in school and some of the time at home. There is surveys are going out from each district asking parents to choose which model that they might be looking at, because schools need to program their staff, their schedules, their teachers, to make sure that they adequately plan for which kids will be in school during Monday, for example, and which will not. That has to be taken into consideration. There's also going to be many more expenditures, many, many more expenditures that come with the cleaning. I want you to know that I am a recovering high school principal, and I'm also a recovering middle school principal and a recovering elementary administrator. And I can tell you that on an average, I would have 1 to 2 custodians during the day and maybe 1, maybe 2 at night. Now, with the cleaning that is expected, you know that that's not going to be anywhere near what is required or what is needed. So there's concerns about the expense and some of the requirements for the cleaning that the Department of Public Health has put out, which we fully endorse because we know that's the right thing to do. But obviously the devil's in the details, and how do we get some of this up and off the ground? I agree 100% that we do need to try this. We do need to kick it off. We need to do it in the most prepared way possible. And I want you to know that schools have been preparing since March 16th to do 2 things. Number 1, distance learning, and number 2, reopening when it comes. And so we have been working with them since March 16th to make sure that that happens. I want you to know that on an average in LA County, all school districts, 80 when you combine them all, there's a total of 2,641,964 meals served every week in LA County. And since COVID began, we have distributed over 400,000 devices, distributing, not to mention numerous Wi-Fis. The health and safety issues are a big concern. The well-being, meaning the social and mental health, are another concern. The security, staffing, the cafeteria, if a teacher becomes ill, we are not going to have an abundance of substitutes. And so we need to plan for if someone becomes ill or can't come to work or won't come to work, how do we deal with that with the hybrid model and the distance learning? Technology as well. You know that when distance learning came out on March 16th, it did not go well because from one day we were teaching in person and the next day we were expecting distance learning. And if you've ever driven a stick shift car, you know that your first day is probably your worst day. And so because of that, we've made a lot of traction and a lot of gains in that area. And to add to that, the California Department of Education and our legislators have really put it into law that online learning, distance learning, I should say, is going to look very different beginning this year forward as opposed to what happened last year. There's going to be a lot of accountability, a lot of check-in, a lot of standard-based instruction, and a lot of assessment. And there's a template that CDE is going to come up with as far as what they're going to ask specifically schools to do. The template is not out just yet, but it's expected out in a few weeks. So schools need to plan according to what some of the requirements that CDE is going to establish as far as distance learning. We're thinking that with what we've learned from March till June, plus add the accountabilities from July on, that distance learning will improve. But again, I don't want anybody to be slightly fooled. It does not compare to in-person learning. I want you to also know that PPE equipment is a major issue, that CDE did provide or is providing all school districts 60 days worth of PPE equipment. They promised this a month and a half ago, and so far in LA County, we were supposed to receive upwards of 400 pallets, and I think we've received 5 to date. Now, school is just around the corner. Things like surgical masks are being promised, face shields, cleaning solution, looking at masks, material masks, and a few other things. Temperature gauge that you could just point and click. So all of that is promised for 60 days. The concern I have is what happens after 60 days, because as you heard everybody here say, this is not going away within 60 days. The issue also of those that are most heavily affected, which is those that are socioeconomically challenged, but also neighborhoods of color. And I agree 100% that we should not wait, that we should take action, that we should not wait for things in COVID world to get better before we start bringing people back. I think we need to act. The problem is this. The problem is we have not acted. What have we done in those communities of color where they are a number one priority for technology, they are a number one priority for hotspots, they're a number one priority for PPE equipment, they're a number one priority for staffing? That has not come to fruition. Additional funds going to those areas around COVID has not come as well. So it is of concern that we're starting off, and I know that the item came up about graduation, which I could not agree greater with the comment that if you start without that diploma, you are in a world of hurt, and not just you, but generations to follow you. Unfortunately, the divide is going to get bigger unless we band together and start to look at resources and where they need to go. Now imagine CDE tells us that we're to distribute this PPE equipment according to ADA, right? So every kid counts. Every kid gets something. Now imagine I go in there and say, wait a minute, there are specific communities that need more of that than you do. Can we have your equipment? The answer is going to be no. That this equipment is given out equally among everyone, and you know that the people that are better prepared, like myself, I'll use myself as an example, I, for my children, do not need that equipment. But there are other communities where they cannot respond the way that I did. What are we doing differently to address that need? Because there are going to be challenges in that area, and if we don't act quickly, and I mean quickly, and I mean like yesterday, then that divide, the academic gap that exists is going to get bigger and bigger. The graduation rate is going to become bigger and bigger. It's not going to get better because you know that the children that I have in my home are going to be well taken care of, and for many of you, same thing. And that's a great thing. But we need to start thinking about the other generations and the other communities. Now, what we've done with our superintendents, I want to be clear that we have met with them daily and weekly as well in the last couple of weeks, because we are trying to provide for them as much guidance and communication as humanly possible. We have conference calls with them weekly. We have over 300 superintendents and cabinet members on our call every Wednesday. And we go over all the health issues, the operational issues, the distance learning issues, so that we continue to make gains. In addition, we send out constant communication to them every other day regarding resources that they might make themselves available to. We've convened task force with 25 of the superintendents to really put the framework together. I want you to know that the LA County Office of Education put out a framework on reopening that really looked at health issues and health practices, operational issues and operational practices, instructional issues, and I think that went over super well because it really came from a lot of the superintendents and a lot of the content experts that LACO had. We've also established a 24/7 hotline. We get calls from superintendents every single day. I think today I got at least 12 calls from superintendents because there was a lot on the news today, obviously, but a lot of their issues around concern about safety, about supplies, about resources for custodials, for cafeteria, and that what happens if someone gets ill. Something new to schools this year is contact tracing. And you know that's been foreign to us in the past, but now we're developing plans at every school site. The problem with the contact tracing is in some of the protocols, it talks about schools being responsible for having testing accessible to anyone that is identified COVID or has symptoms of COVID. And that is going to be real challenging for us because if you've tried to get tested recently, it's been very, very challenging. Not to mention if you live in certain parts of the city, it's going to be twice as difficult to do that. So we're concerned about that. We are working to distribute that personal protective equipment when it arrives, and Dr. Ferrer has agreed to get on teleconference calls with the superintendent once a week to be able to talk to them and then talk to her to have good communication. My hat does go off to the County Department of Health because I know the challenge that they're under, and in my opinion, They have been very communicable with us. They have talked to us and met with our superintendents on many occasions, and we truly appreciate it. The good thing about California today is that we had anticipated the budget cuts because of the economy was going to be drastic. You know what happened in 2008 with the recession. That recession lasted about 3 or 4 years before we were able to begin to recuperate. And the prediction for this is something a little worse in nature. Fortunately, we did not get the cuts that we were expecting, which is great. We did get some additional federal and state funds around coronavirus, and we are hoping for additional federal funds to help with some of the additional COVID costs. But, you know, currently there is no COLA that I know of. There are deferrals that are being put on the table, and California is ranked 41st in education spending-wide. And that in itself is complicating the COVID because it's a lack of resources that we have available to us. The one thing that I can add is this then we need to really look at how do we turn the situation with COVID-19 into something a little more positive. And the one thing is that we have communicated better with our 80 districts than we have in the past 20 years. And that is because it's really brought all superintendents together. The one thing we preach to the superintendents is that it's up to them and their communities to make an informed decision on how best to open the schools, and everybody is going to have something that looks very different, and that's based on the needs, on the resources, and the community needs as well as far as what they are saying, and of course their boards. So we're looking more at partnerships with a lot of our community-based organizations and partnerships with our county departments, like, for example, the Department of Children and Family Services, and you heard earlier that there's a 50% decline in child abuse reporting because our teachers are not there to be vigilant. And so we partnered with DCFS to work with our teachers and provide professional development for them to see what things they might look at even through telecommuting and Zoom conferencing that they might identify when kids are at risk or kids are stressed or times for interventions. And so we're working diligently with them. So partnerships is going to be critical. Advocacy is going to be another issue that we are really looking to strengthen. Advocacy at the city level, the county level, the state level, and the national level. And we've developed great new partnerships, and we're looking forward to continuing that work because we want to be at the forefront of legislation around distance learning, hybrid, getting kids back to school in a safe, productive manner. And then, of course, there's the teaching and learning. And we need to do a better job at training, and we have to invest much more money in training, especially with teachers and the distance learning. There are a lot of teachers that are not familiar or tech savvy. As a matter of fact, when this group, when I was involved in setting up the practice run for this, you know how frustrating it was when we all struggled a bit in one way or another. But we all worked together, and we all got it done. And I think teachers also are going to need a lot of hand-holding as we move step forward. The last thing I'm going to say is this is an opportunity to talk boldly about racial justice and social equity, because what we have failed to mention in all this reopening is the situation with the social unrest, with the death of George Floyd, of Black Lives Matter, and what we need to do as institutions to do a better job to make sure that we are sensitive, that we are looking at our policies, our practices, and making the change happen. This is an opportunity for us to really turn the corner on something that has been going on since before all of us were born, and will continue if we don't say that this is the generation that's going to make it happen. But with that, back to what I'm going to call him Susie because that's the name that's on the screen. But the fact that he talked about the graduation and the divide and the generations that are going to suffer if we don't take the action today, I tell you today that we're going to work as hard as we can at the County Office of Education, and we're going to continue working with our 80 superintendents to really push the agenda to get back our kids in the safest manner possible. thank you for your time. I appreciate the honor of talking to the City Health Commission. Anything that we can do to strengthen the partnership, please reach out to us.
Thank you, Superintendent Valdez. For the public, my name is Dr. Howie Mandel. I will admit that I'm a Luddite and could not change easily the Google placing of my wife's name on this platform. So I'll stand accepting the fact that technology can be difficult even for people that are fairly intelligent. Before we go on to questions, I want to thank you for your entire presentation and for your efforts on behalf of all the students in LA County. We know how hard you and your department work to improve the education, and I think that I can speak for the Commission to say that we support everything that you've said in regards to social justice and the importance of education for improving our society and improving how people learn about making change and improving the lives of people in our communities. I would say one thing unrelated to that, but in regards to the impact of food and hot meals are important, but unfortunately it's an increased risk of transmission depending how you do it. So I would just beg that people look into the fact that maybe having wrapped food that was prepackaged, as much as it's not ideal, that we have to make some compromises in this time to limit spread of the disease. And so potentially for some period of time until it's worked out, that packaged food, either on the schools or brought in, would be a healthy way to go. And with that, I would open up to questions. Commissioner Avila, do you have any questions? Commissioner Hisrick.
No, I just would turn the thing off so I could say no.
Great. Commissioner Estrada's.
I don't think I can hear.
You're muted, Commissioner Mandel.
Commissioner Grimmick.
No questions for me. Thank you.
Thank you. Commissioner Sirota.
I just want to say thank you for the presentation. Really knowledgeable, and enjoyed listening to it.
Thank you. I think we all agree on that. Commissioner Kalfani.
Just a quick question. You had you mentioned kind of missed opportunities when we had to switch to go to, I guess, online learning. What has been done to prepare or to actually resolve some of those challenges in terms of families not having laptops? Or what's been done to resolve those issues, especially think about going forward?
I think it's a great question. I want you to know that when we began distance learning and technology going out, that our goal was just to get everything out as quickly as possible. But I think a lot has been learned that not everything should go out, that we should be very methodical about who gets what, the bandwidth, and how much they get, and who's going to be coming in for a hybrid type of approach. So the districts are talking about being much more strategic about using their limited supplies in the most effective way possible. But there's been a lot of partnerships also with a lot of foundations and a lot of organizations that have donated, a lot of companies that have donated hotspots and computers. So we're being much more strategic about what we do in inventorying what exists in the home around existing computers and laptops versus what doesn't, and then comparing that to what we have and what's going out there. And then just making sure that all of our equipment is returned, refurbished, and ready to go out. It's going to be a really quick turnaround, but I think we're excited about doing it much better. It's almost like March till June was the worst case scenario of doing it without very much no professional development and no training. But now that we've got ourselves in a better situation as far as that, we're very hopeful that we're going to be able to solve not all of the problems, but more of the problems, and with the right groups as well.
Thank you for that. And I guess just to follow up that, so in addition to equipment, for parents who may not be as familiar or comfortable or need some additional support for helping with their kids with computers or laptops, what's also being done to support them, to support the kids, with distance learning?
So part of the main focus is going to be on professional development for teachers, but I want you to know that we have learned and understand that part of the professional development has to include parents. We are not going to be having parents come in to in-person meetings, but we need to be able to provide some online assistance for parents that might not know specifically how to work the computer or how to best help the child at home or even how to monitor the child at home. So that is going to be put into place as far as providing some professional development. I want you to know that my wife is a TK, transitional kindergarten teacher, and when she was doing online learning for some of her parents, these are new parents. You throw in new parents, new technology, they're at home now, and you have to help them, and that is probably the eye of the storm. And so a lot of their concerns were about scheduling, were about how to use the computer, how to discipline the child at home when they didn't want to do some of the work. So everything from A to Z was coming forward, but it was an opportunity to learn and really to get our professional development in place on what teachers need to do when they meet with parents. Because it shouldn't just be a one-on-one with the student. There should be that connection, regular connection with parents and checking in with them to make sure that they're getting the right supports they need in order to help that child.
Okay. All right. Thank you.
Commissioner Cotto.
Yes. Hi, Dr. Valdez. Thank you very much for your time. Just a few clarifications. You were saying that, if we don't act quickly, we won't be able to help these kids. Now, when you're saying we, who are you referring to?
I'm referring to everybody, the entire community, the legislators, the politicians, the principals, the superintendents, the parents, the teachers. I'm talking about everybody, all hands on deck.
And, there's got to be someone that could move or all these hands on deck, because you're saying that you're promised 400 pallets of PPE and you got like 5, which is like 1%. And, there's no way that, you're going to be able to do anything with that. You're talking about also, it all has to be distributed equally, even though certain areas might not need it. And you're talking about it's a systematic problem, don't you see? If you can't adjust, and you're talking about racial justice, social equity, but these guys, because of this we that is so big and so stuck, can't act. Like what Dr. Quo was saying, why instead of being all in or all out, why can't we identify places that want to start and do that? But there isn't a part in the we that could help facilitate that. So, I'm sorry, it just seems like we're stuck. And, if you could give me some hope with a solution to that, I'd much appreciate it.
Well, I think it's a tough question, and Mr. Cotto, there's no way that I can ever underestimate what you're saying, because we've been at this for many years, and this is not going to change overnight. But I think if every organization looks internally at what they're doing, and I can tell you that LACO is looking excessively internally at what we're doing, because we don't want to do things the way we've been doing things in the past. We want to redirect all of our personnel to really hands-on deck with all of this COVID-19 and distance learning and hybrid, so that we can support districts in the best way possible and provide them the most support. So if every organization is looking at doing something like that, I don't think there's one easy solution to this, but I think it's a group by group, organization by organization, individual by individual taking action.
But I think these schools, like in the more impoverished areas, like they're just crying out for help. And as Dr. Mundell was saying, can't get them going. You know, it's generations of inequity for that family line. And yeah, God, I pray that, you know, someone could get this thing going somehow. You know, at one point, just get a prototype, get that prototype moving, and maybe people see the results. But you know, if everybody's sort of not wanting to step on each other's toes, hey, you know, you're going to lose a generation or two. I'm sorry, but it's just, you know, I just feel frustrated, you know, because I feel the urgency for this to get going, and it just doesn't seem like we are. So. Well, thank you.
Thank you.
Commissioner Ossie, do you have a question?
No questions at this time. Thank you for the presentation.
Thank you. Commissioner Shannon.
Hi, thank you so much for the presentation. I really think it's time for the county to provide universal access to the internet. I mean, the fact that we're looking now at children and parents, you know, parents who have school-age children not being able to access the internet, not having the equipment that they need in LA County is fairly unconscionable. This is one pandemic that we are facing. We have no idea what's coming in the future. And the fact that we have these disparities in our county when there should just be universal access to the internet, I think is unconscionable. And I hope that you will take that back to the county supervisors, that this would be a good time to be looking at universal access to the internet. I'm wondering if you have an estimate of how many children are without access to the internet or without equipment. And then I have another question that I'll ask now too. You were mentioning about the doors being propped up at schools, which I think is a great idea. But what about like bathroom stalls or places where that's not going to be doable? If you could respond to those too.
So, you know, there was talk earlier about having wash stations throughout the school so that it's readily available, or having no-touch water faucets or soap dispensers. I can clearly tell you, and I'm not trying to be a downer on this, that is not going to happen, because the cost of that, of which we've all looked into, has been very staggering. So everywhere that we have looked, we have investigated, we have seen what we can do, it's going to be a challenge. What we're looking at now is looking at hand sanitizers, and then just making sure that we have constant visits to the restrooms. But the stalls do need to have their closure, obviously. The restroom doors to the entrance of the restrooms can be propped open. So everywhere possible, we're going to do our very best. But I'm a firm believer that the stalls need to have their doors, and those need to be secured for privacy. However, the bathroom doors could be ajar where a student can walk in and not have anyone see anything that they're doing. So we're looking at all options. The plexiglass, I want you to know that that is not readily available. If I want to order as much plexiglass as I want, or masks, or shields, or hand sanitizers in the bulk that we need in LA County, is not available. The other thing I wanted to mention that you identified is the technology and the laptops. There are some districts in LA County that have gone to the one-to-one prior to the COVID. Now, they planned and they maybe saw the future, and they put the money there, and they're in a much better place, like 100 times better place than those schools that didn't plan, because they didn't maybe set aside those dollars, or their dollars were stretched already. So there's that positives that we know that the districts that have done a great job are going to continue. We now know that districts need to have a one-to-one model in every single district in LA County, even after COVID is over, because I'm not sure that education is going to look the same after COVID-19. I think this telecommuting and distance learning is going to have some remnants of education when we all come back to whatever our new normal is going to end up being. As far as the number, and I'm sorry I don't have that handy, but we did survey the districts to find out how many required hotspots or laptops, and I don't have that number handy. I'll be happy to send it to the commission so that you have it and can distribute it. But we did survey all 80 districts, so you'll get a sense as to how many are lacking hotspots and laptops.
Okay, thank you.
Thank you. In regards to the lavatories, it is possible to do what many high-rise buildings have done with elevators, which is just easily to hang a paper towel dispenser on the outside of the bathroom and then inside the bathroom, so a student can take a paper towel, open the door to the stall, and throw that into a small paper basket. Not the toilet because it'll clog the
right.
And then the same thing, have one on the inside of the stall that would be used to open the latch to allow them to exit after they wash their hands. So there are ways to do it that don't have massive costs. It does take a little bit of thinking proactively. But we thank you for your commitment. Commissioner Whittington. Commissioner Stanton, do you have another question?
No, that's all. Thank you.
Commissioner Whittington.
No comment. Great presentation. Thank you so much, Commissioner Mendel.
Thank you, Superintendent Valdez. We have some other small business to do. We truly appreciate you taking time off to take time off on Friday to meet with us, and then also again today. We truly respect what you're doing and your dedication to all the students in LA County. Please give our thanks to you as well as to the superintendent of the entire system. We appreciate your efforts.
Thank you, everyone.
Thank you very much. Looking on to the next agenda item, future discussions. Let me just mention one thing that I think is important to be on the record. We have discussed repeatedly and for several years and in our report the importance of having funding for this commission so that we could have the staff support with credentialed staff, MPHs, high-level people to do research so that we could address issues. We had presentations early in March. We were the first commission to really address this massive issue of COVID. We have addressed an issue of schools. We are proactive. We have the ability to have a positive impact on the city council and the mayor's office and give them good advice if we just have a little bit of resources. Lobsters grow under stress, and at some point they outgrow their shells because they're too big. When that happens, they shed their shells and they regrow new ones. So we can take this time of massive stress on our society and potentially use it for a time to learn and grow so we can improve the public health of people, to improve social justice, to get rid of disparities, so that we can meet the missions and goals that we all should have. And to do that, we're going to need some resources. So I think one of the future discussions we should have is to once again address the fact that without resources, we can't properly give the data that the city council and the mayor needs. Anybody else have any other future discussions that you'd like to discuss now? You can also email the commission leaders and or the city clerk, and so that we can move things for the future agendas. Anybody have anything they want to add?
I think if we could talk about income disparities and COVID transmission and the lack of resources in low-income communities, I think that would be a great discussion to have next month.
I think that would be a good thing to have on our agenda. Commissioner Cotto?
No, I just wanted to say that the agenda item that you proposed, it was brought up in the past, correct, and presented to the council, but was no action taken, or did we get money that year that we requested it? It's just a question.
We have not gotten. We have a budget line item of 0 directly to the City Health Commission. We have asked for funding several times, including having it in our report. I presented to the committee of the council that has oversight for public health, and was warmly accepted my recommendations. That would have to be a city ordinance and part of the budgeting process. Unfortunately, as you know, the city currently has a massive budget problem. I still think that we should be a priority. We should make that a priority, possibly having a future commission meeting on that. I think would be beneficial. I do think that Commissioner Shannon is correct that her recommendation should be more of a priority than the funding, but we should definitely have it as an agenda item coming forward. Other questions or areas that somebody wants to bring up, please know you can also email myself or the vice presidents or the city clerk with suggestions. We're always open to have them. Seeing none, is there a motion for adjournment?
Move for adjournment.
Thank you, Commissioner Shannon. Is there a second?
I'll second.
I'll second.
Any discussion on adjournment? Hearing no, I'll call for a vote. All in favor?
Aye.
Anybody
Aye.
opposed? Hearing none. Anybody abstaining? Hearing none. Officially, right before we're adjourned, I want to thank the city clerk, the city attorney, and all the support staff for their efforts, not just today, but what they do daily to improve the lives of the people of Los Angeles. The city is better for your service. We truly appreciate it. Thank you very much. We're officially adjourned.
Thank you.
Bye.
Bye,
Thank you.
everyone.
Thank you.
I'd also like to thank the interns for their hard work and dedication to get this, everything we do, but definitely today, getting this up and operational. Thank you, Lauren, Sarah, for all the work that you do. Marvin, if you're still there, I don't see you. But yeah, there you are. Marvin, thank you also for your help. We look forward to working with you going forward, and we truly, truly appreciate all you do for the city of Los Angeles.
Thank you.
Thank you, Rita. Ms. Moreno, you're wonderful. We're still on recording. I say Ms. Moreno, officially, we truly, truly appreciate everything you do for the commission. The commission could not function without your dedication to help.
Good night.
You're welcome. Good night, everybody. I'm going to stop recording now.
Thank you.
Recording stopped.